quarantine times in half for people with COVID who are not exhibiting symptoms. President of the Association of Flight Attendants, Sarah Nelson, says in a statement, "We wanted to hear from medical professionals on the best guidelines for quarantine, not from corporate America advocating for a shortened period due to staffing shortage." She continued, "We cannot allow pandemic fatigue to lead to decisions that extend the life of the pandemic or put policies on the backs of workers." Sarah Nelson joins me now. Sarah, thanks for being here.
Thank you.
One of your primary arguments against this new 5-day quarantine period, down from 10, is that it started at Delta's urging. Explain that for us.
Well, our concern around this is that Delta is using this as a hammer to have workers come back to work before they are ready, before they are fully well. And in fact, Delta is the one airline that has put its policy out, cutting sick leave pay in half and not mentioning even the asymptomatic condition that CDC is recommending at those 5 days. So CDC was very clear, even though we opposed the guidelines overall, what they said was that someone needs to be asymptomatic and they need to continue to wear a mask, a properly fitting mask, for the next 5 days when they are around anyone. Those items were not clearly communicated even in Delta's policy. And so our concern is that when this is driven by corporate America, this is driven by an airline that did not properly plan for the holiday period, they're putting this now on the backs of workers and trying to get the government to give them the excuse to force people back to work before they are ready and to cut their sick leave pay so that they have the means to get better.
JetBlue, switching over to a different airways, has announced they're cutting more than 1,200 flights through mid-January to prep for the continuing surge of COVID cases among pilots and flight attendants. The thought behind this shorter quarantine period for asymptomatic people is that it could free up some staff members, which in turn would help get the flight economy back on track. Is there merit to this argument?
Well, look, we have worked with the industry throughout the pandemic to put in place policies that are even over and above what the federal government is calling for. And there may be some merit to people who are asymptomatic, who are less likely to be infectious coming back, and who can test before they do. So there are protocols that can be put into place so that people can come back to work sooner and work those flights for those who are able and ready. What we are concerned about, though, is pushing people back into this space and not having a testing protocol, not making sure that the people who are coming back are not infectious so that we're continuing to spread this. Even CDC says that it's 90% effective at that 5-day period. That means that we know for sure that we're putting infected people back into the workplace. We're putting passengers who are infected back onto our planes. And this is just not a good policy. The industry asks for only breakthrough cases to be identified. So those people who are vaccinated. The CDC's policy includes both vaccinated and unvaccinated. And as they have explained themselves, there's going to be a higher dose of coronavirus in those unvaccinated people, which makes it more likely that they will spread. In either case, this is just not good policy to make sure that not one more worker dies during this period. We should address the flights. JetBlue is proactively canceling those flights so that people know that is better than leaving people stranded, telling them that they're going to have a flight that they're not going to. But we will recover in January. And it's just important to remember we are in the middle of the pandemic still. So let's continue to put safety first.
Sarah Nelson, thank you so much. We appreciate your time here on Morning in America.
Thank you.
While unthinkable tragedy unfolded in Thursday's Marshall.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.